Hi, this is my PO return. I'm wearing the correct uniform. I have my stethoscope, my name badge, my watch, pen and pen light. I'm wearing the correct uniform, closed-toe shoes on, and this is my workspace. Okay. Alrighty, so going to begin and by washing my hands. Okay, washing my hands nice and thoroughly. Okay, I'm going to locate my mark and identify any allergies. Alrighty, so I have my MAR here. Vanny Fundamentals, 11/3/1955, no known allergies. And I'm going to go ahead and do my first round of 6 rights. Okay, so I have Lanoxin, and I have the correct patient, Vanny Fundamentals, 11/3/1955, Lanoxin, 0.25 milligrams is the dose, 0800 is the time, and the route is orally. I will document later, and the expiration date is 05/2022. Okay, the next one I have Lotensin. So I have the correct patient, Vanny Fundamentals. I have the correct dose, 20 milligrams, 0800. The route is orally. I will document later, and expiration date is 05/2022. Alright, next I have Lasix. So patient, Vanny Fundamentals, Lasix, 80 milligrams, 0800, orally, and I will document later. The expiration date is 05/2022. Next one, I have Cardizem. So patient is Vanny Fundamentals, drug Cardizem, dose is 180 milligrams, time is 0800, the route is orally. I'll document later, and expiration date is 05/2022. Alrighty. And next I have Micro-K. So Vanny Fundamentals, Micro-K is the drug. The dose is 80 milliequivalents. The time is 0800. The route is orally. I'll document later, and expiration date is 05/2022. Okay. And lastly, I have the correct patient, Vanny Fundamentals. The drug is nitroglycerin patch. The dose is 0.4 milligrams an hour. The time is 0800. Route is transdermal. I'll document later, and expiration date is 05/2022. Okay. Now I'm going to do my second 6 rights. I'm going to be doing the same 6 rights there, and I'm also going to be listing drug information. So the class of the drug, mechanism of action, side effects, and any specific assessments that I need to do prior to administering the drug. If I do need to do an assessment, I'll put it in this class right here, and if I don't, I'll put it in this one. Okay, so I'm going to go ahead and get started here. So I have Lanoxin, patient, Vanny Fundamentals, Lanoxin, 0.25 milligrams, scheduled 0800, route is orally. I'll document later, and the expiration date is 05/2022. Alright, Lanoxin is a cardiac glycoside, inotropic, anti-dysrhythmic class. It inhibits the sodium-potassium ATPase pump, which makes more calcium available for contractile proteins, resulting in increased cardiac output, increased force of contractions, decreased heart rate, and decreases AV conduction speed. Some side effects that can occur are dysrhythmias, AV block, hypotension, headache, drowsiness, blurred vision, nausea, vomiting. And special assessments, I will be assessing the patient's heart, and I will hold this medication if the heart rate is less than 60. So I will put that in here. Next drug I have is Lotensin. Okay, and so patient, Vanny Fundamentals, Lotensin, 20 milligrams, administered at 0800. Route is orally. I'll document later. Expiration date is 05/2022. Lotensin is an anti-hyperintensive angiotensin-converting enzyme inhibitor. Selectively suppresses renin-angiotensin-aldosterone system, inhibits ACE, thus preventing conversion of angiotensin 1 to angiotensin 2. Some side effects that can occur are hypotension, angina, insomnia, anxiety, nausea, constipation, hepatotoxicity, pancreatitis, Stevens-Johnson syndrome. And I will hold this medication for if the blood pressure is less than 90 systolic. So I will be getting the patient's blood pressure before administering. Okay, next one I have is a Lasix. So I have the correct patient, Fanny Fundamentals, Lasix, dose is 80 milligrams, time 0800, route is orally, I will document later, and the expiration date is 05/2022. So Lasix is a loop diuretic. It inhibits reabsorption of sodium and chloride at proximal and distal tubule and in the loop of Henle. Some side effects that can occur: increased urination, thirst, muscle cramps, nausea, vomiting, tinnitus, hyperglycemia, hypokalemia, and metabolic acidosis. Special or specific assessments: watch eye, nose, and watch for arrhythmias, but nothing right before medication is administered. Okay, next one I have Cardizem. So I have the correct patient, Fanny Fundamentals, Cardizem, 180 milligrams, administered 0800, route is orally, I'll document later, and expiration date is 05/2022. Cardizem is a calcium channel blocker. It reduces intracellular calcium concentrations equate to increased smooth muscle relaxation, resulting in arterial vasodilation and decreased blood pressure. Some side effects that can occur are dizziness, lightheadedness, weakness, nausea, vomiting, flushing, sore throat. And specific assessments. So I will hold this medication for a blood pressure less than 90 systolic and hold for heart rate less than 60. So I will be checking the patient's heart rate and blood pressure before administering this medication, Cardizem. Okay. The next one, I have MicroK. So correct patient, Fanny Fundamentals, MicroK. Dose is 8 milliequivalents. Time 0800. Route is orally. I'll document later. And the expiration date is 05/2022. Alright, so MicroK is an electrolyte mineral replacement. It's needed for the adequate transmission of nerve impulses in cardiac contraction, renal function, and intracellular ion maintenance. Some side effects that can occur are confusion, bradycardia, cardiac depression, dysrhythmias, nausea, vomiting, cramps, pain, diarrhea, oliguria, cold extremities, and rash. And specific assessments is monitor potassium levels, but so nothing right before the administration of the medication. Okay. Next and lastly, I have the nitroglycerin patch. So correct patient, Fanny Fundamentals, nitroglycerin patch. Dose is 0.4 milligrams an hour. Time 0800. Route transdermal. I will document later. And the expiration date is 05/2022. Alright, so nitroglycerin patch is a coronary vasodilator. It decreases preload and afterload, which are responsible for decreasing left ventricular diastolic pressure, systemic vascular resistance, and improving overall blood flow. Some side effects that may occur are headache, flushing, dizziness, postural hypotension, tachycardia, syncope, palpitations, nausea, vomiting, pallor, sweating, and rash. And I will, so specific assessments, I will be checking the patient's blood pressure, and I will hold this medication if the blood pressure less than 90 systolic. So I will put that under here. Okay, so now that I have performed my 2 rounds of rights, I'm ready to go to the patient's room. I'm going to bring my MAR as well as the drug information sheet, and of course my medications here, and my other materials. I'm going to go ahead and bring Mr. Patient around, this patient. Okay. so I'm walking into the patient's room and I'm going to begin by washing my hands. Introducing myself. Hi, my name is McKayla. I'm going to be your nurse today. How are you? Good. Okay. Alright, so I'm going to be administering some medications, but I'm going to be doing a couple checks before I get started. Could you please verify for me your name and date of birth? Yeah, it is Fanny Fundamentals. Okay, 11/3/1955. Alright, wonderful. And Fanny, are you aware of any allergies? Drug allergies? No? Okay. Awesome. Thank you, Fanny. No allergies. And I'm going to go ahead and raise your bed here. Alright. And also, so I'm going to be administering some medications, like I said, and you're going to be taking them orally. Are you having any problems swallowing? No? Okay, wonderful. And also, before we get started, I'm going to take your heart rate and blood pressure. I have a couple medications here that require me to take those and make sure that they're in the correct values before administering the medication. Alright, so I'm going to be taking Fanny's apical pulse. So I would be holding and taking it for a minute, and then also blood pressure. Okay. Okay. For the sake of time, we're going to say a minute has been up, and so Fanny's apical pulse was 82 beats per minute. And so I'm able to give those drugs that needed the heart rate to be above 60, no lower than 60. Okay, so now I'm going to take blood pressure. Okay, Fanny's blood pressure was 120/80, so systolic blood pressure, like I said, 120, so above 90. Okay. Okay. Alrighty, so those are good. I'm able to administer those medications that needed the special assessment. And now I'm going to go ahead and perform my last 6 rites by the patient's bedside. Okay, so my drugs here, and I'm going to be pouring the drugs that she's going to take orally into this, and this will be Fanny's glass of water now. Alrighty, so first we have Lanoxin. Okay, so correct patient, Fanny Fundamentals, Lanoxin, 0.25 milligrams, administering at 0800, route is orally, and I'll document later. The expiration date is 05/2022, and Lanoxin special orders, just double checking that. So it said to hold for a heart rate less than 60. Heart rate was greater than 60 at 82, so I can take this one. Okay, and next one we have Lotensin. Alright, so correct patient, Fanny Fundamentals, Lotensin, 20 milligrams, 0800 is the time of administration, route is orally, I'll document later, and expiration date is 05/2022. And just double checking, so Lotensin, I would hold for blood pressure less than 90 systolic. Fanny's systolic was 120, so that's good. Okay. And I have, next one is Lasix. So, correct patient, Fanny Fundamentals, Lasix, 80 milligrams, scheduled at 0800, route is orally, I'll document later, and expiration date is 05/2022. There was no special things for Lasix, so I can go ahead and administer that. Alright, and next I have Cardizem. So, correct patient, Fanny Fundamentals, Cardizem, 180 milligrams, administering at 0800, Route is orally, document later, expiration is 05/2022, and I checked Fanny's blood pressure and heart rate, and they're both good, so I can administer that. And I have micro-K. So correct patient, Fanny fundamentals, micro-K. Dose is 8 milliequivalents, scheduled at 0800, route is orally, document later, and expiration date is 05/2022. Micro-K didn't have any special assessments, so I can go ahead and get that one. And lastly, nitroglycerin patch. So I have correct patient, Fanny fundamentals, nitroglycerin patch. Dose is 0.4 milligrams an hour, administering at 0800. Route is transdermal, I'll document later, and the expiration date is 05/2022. And I checked Fanny's blood pressure. It is in a good stand there too. Oh, oops, I would not do that because, sorry. Okay, this is a patch. And I'm going to just put that here. Okay. Alrighty. So, now that I have done my checks, I've checked Fanny's heart rate and blood pressure, and now I am going to, so Fanny, like I said, I have some medications here for you today. I'm just going to go over them briefly, making sure you understand why you're taking them and how they help you. Please let me know if you have any questions, okay? Alright, so I have Lanoxin. Lanoxin helps your heart beat stronger. Next, I have Lotensin. So Lotensin helps regulate your blood pressure and keeps it in a normal range. And then I have Lasix. So Lasix rids of any extra fluid that your body is holding on to. So helps with edema or swelling. Just gets rid of any extra fluid. And then I have Cardizem. So Cardizem helps keep your blood pressure and heart rate in a normal range. Next, I have Micro-K here for you. So Micro-K is a potassium supplement. And so we want to make sure that we're keeping your potassium levels in an adequate range. So not too high, not too low. And a lot of times we pair this with when a patient is taking Lasix, because a lot of times with Lasix, your body will rid of those potassium, so those potassium levels will decrease and go down. So we want to make sure that we're supplementing that with potassium, okay? And lastly, I have a nitroglycerin patch here. So the nitroglycerin patch helps with your overall blood flow and helps get that flow of blood back up to the heart. All right, so any questions for me? No? Okay, wonderful. So I have here a glass of water for you and your medications that you will be taking orally through your mouth. You can take them all together or one at a time or however you'd like. All together. Okay, so here's that. And here's water. All right, Fanny, how'd that go? Good. Okay, wonderful. All right, so now I'm gonna get you your nitroglycerin patch, and I'm gonna first put on my gloves. Okay, so I have my gloves on, and now I'm going to get the patch ready. And I'm going to make sure that when I'm putting on this patch that I am rotating sites. So right now the patch is on Fanny's left side, so I'm going to put it on the right side, and I'm going to put the time, date, and my initials on the patch. My initials followed by SN for student nurse. Okay. And I'm gonna go ahead and take this off. So fortunately, Fanny is a teddy bear, so it's pretty hairy, but usually I would choose a spot that is not as hairy. Okay, and this is gonna give me a hard time. Okay, this would be much more gently with the patient in real life. Okay, I'm going to put this on here, and now I'm going to wipe off any excess fluid here, put this in the biohazard. Okay, and now alrighty. Alright, Fanny, is there anything else I can do for you? No? Okay, so I'm going to take off my gloves. Alright, place this in the biohazard container. And please press this call light if you need me. I can lower you back down if you want. Alrighty, I'm going to go ahead and wash my hands. And I am done. Thank you.